Nice to have you with us on a Wednesday where we speak matters medical with our resident GP, Dr. Vicky Skitter. Hello, Doctor.
Hello, Jeremy.
Had a bit of a family wobble this last week because my mother, who is in frail care centre, had a fall.
Oh, dear.
Yeah, quite a bad one actually.
Oh, shame.
So she's bruised all one side of her body. Not one bone broken though, which
That is amazing.
That's
How old is she?
95.
Wow. Okay. No, that's amazing because that's often how they do break them.
Is that usually through osteoporosis?
Yeah, osteoporosis is very common after the age of 80 specifically.
But so it's over 80s that are at risk. What exactly is osteoporosis?
Look, it's basically a disease classified as it's a decrease in bone strength and the propensity to fracture. There's definitely some microarchitectural changes in the bone itself as well. I've proven that. It's very common in postmenopausal women as well, due to the lack of estrogen, and then you've definitely got an increased bone loss between the age of, say, 45 to 60. But high-risk patients, besides menopause, would also be patients with parathyroid or thyroid issues. So if you're walking around with an overactive thyroid for a long time, that can cause problems. Patients on bone toxic medications, so chemotherapy, long courses of corticosteroids, certain anticonvulsive, and there's some talk on patients that's on anti-reflux medications, antacids, they call the PPI, proton pump inhibitors. If they're on it for long, it can cause osteoporosis. Those patients that had gastric bypass or gastrectomies, for weight loss, they sometimes become, nutrient deficient. So they can also develop that. Same with patients with a low calcium intake or not enough sunshine or not enough vitamin D, something like that. Major weight loss in a short period of time. They often don't just lose the weight, they also lose bone mass, like anorexia as well. Same thing happens there. Or surgical menopause, when you get a hysterectomy and your ovaries get taken out as well, that sometimes happens. Then you lose your estrogen early in life, and that can be a problem. So they say about 15% of Caucasian patients over the age of 50 will have it. And as much as 70% of patients over the age of 80 will have osteoporosis. And even worse in patients that's institutionalized, like your mom in frail care, or when they sort of chronically ill, very ill patients. And obviously it's worse in women as well, worse in women. So I think it's an important thing to think of, to check, high-risk patients and us older women.
Us older women.
Aish, man, the menopause.
So it's a pretty wide-ranging disease. Why is it that older people fall so easily?
It's a problem. So look, if you think about everything that goes wrong when you're older, obviously your vision goes a bit. So they often have multifocals or bifocals or different glasses to read with and different to see far. Now they're reading their book and get up and go and make some tea, and then I can't see properly, then they fumble and fall. That's like one of the common things. And then their muscles aren't as strong, their balance is a bit not great. They often have, from diabetes, they can get peripheral neuropathy, so the feeling in their legs and feet aren't that great. They're often on lots of medications, so some of the medications can cause a bit of delirium, or maybe their blood pressure drops too low when they get up quickly. When you've got something like dementia or even Parkinson's, they shuffle, so they're not so solid on their feet. That's a common one. And also they often have osteoarthritis, or even rheumatoid arthritis, but all old people have osteoarthritis. So they sometimes have deformities and stiffness and pain, so they walk funny. And the problem is, once they've fallen, then they're very scared. They lose confidence. And once they've lost confidence, they move less. So then the problem becomes worse. Even if they don't break anything, or even if they don't hurt themselves too badly, they still lose confidence, and that can make everything worse. So it's important to keep all of those things in mind, especially our elderly that's in frail care and institutions like that.
What can help or what can you do to help or help prevent these falls?
Okay, so there is quite a lot one can do. So you can look at physio and biokineticists. They can assist them with strength and balance, training type thing, and also address the fear of falling. And they can also assess for any assistive devices, whether they need a crutch or a walking ring or something like that, and they can help them also use it properly. Then we can obviously manage the contributory medical conditions. So if a patient's got uncontrolled blood pressure or diabetes or pain, you're going to obviously treat that. That's quite obvious. Then you need to rationalize the medication. I mean, I look after frail care, near my practice, and to rewrite chronic scripts for those oldies, oh man, it's like 13, 14, 15 medications, and those medications, they either get confused with it or, they've got side effects. So one must just make sure that they're not over-treated,
Yeah.
Also, often they're on 3 different pain medications or 2 different sleeping pills, and you don't realize it. But so check that. And then occupational therapy can also help them. And that's why we've got the OTs that can help them, minimize the risk by modifying the environment maybe. Silly things like a wire or anything, a connection lying on the floor, or or a low chair standing somewhere, silly things like that. And then sometimes you can try and change your behavior, but you try and change your behavior and tell the Tanny of 90 that you can't have your whiskey at night. That ain't going to happen. I think that's unfair. But maybe just check that if they take their sleeping pills, for example, they don't take it while still watching TV, take it in bed so they don't fumble about after taking their meds. There's a lot we can do. We just take it slowly and try and explain it to them slowly. And maybe don't say you must stop drinking your whiskey at night, because that's why you're falling. Except if they drink half a bottle, that's going to be a problem. Yeah.
How do you diagnose osteoporosis?
Osteoporosis is the best diagnosed with a bone density test. You can go, your GP or your specialist or your gynae or whatever can refer you to any hospital. Most hospitals or bone and breast care centers do them. They say a bone density test can predict a hip fracture almost as well as blood pressure can predict a stroke. So it's it's quite a sensitive test. So it's interesting. So one must realize you reach your peak bone mass between sort of 20 and 30, in the 2030s. Okay. So there's obviously genetic factors that play a role, and also exposure to estrogen, so the age of your first period, if you're a female, your nutrient intake, your diet is important. Obviously, how active you are, how much exercise you do, you can obviously increase that, or not reach your peak bone mass then. And if you're going to start off in your 30s already not having your peak bone mass, then you're already prone to osteoporosis later, because you will reach your peak bone mass, and then you'll have normal age-related bone loss, which is about 0.5 to 1% of bone per year. And then you get an accelerated bone loss when you go through menopause, or males when they go through andropause, we call it, when their testosterone levels drop a bit. So that will be anything between 1 and 5% per year. So that's quite a dip. So one must be very careful during those periods, you know, to treat if you can treat, if there's anything that you can prevent. The warning signs of osteoporosis often when you have a low impact fall or break, when you break something and it's a low impact fall, you know, usually forearm or hip or vertebra, and you don't stand on something, you just fall over and break something. You can sometimes actually see it on x-ray as well, but that's when it's like really quite far down the line. But so bone density would be the best thing to do.
Okay.
Yeah.
Can osteoporosis be treated?
Yes, so sometimes it's as simple as just making sure the patient's taking their vitamin D or calcium supplements, or maybe those symptomatic menopausal patients are treated with hormone replacement therapy if they're a candidate for that. But then the proper osteoporosis treatment, that you get the anti-resorptive therapy where it reduces the bone loss before you have a fracture. Okay, so you want to prevent that fracture. You get oral and intravenous medication. So oral can be a daily tablet or a weekly tablet, sometimes a monthly tablet. The injectables, sometimes once a year, you go for like an infusion. The orals, one would maybe give it for 5 years and then check the bone density. You might be okay then. Where the intravenous, 3 years after, I think they test, and then hopefully that's it, if you're lucky. But then you also get those patients that's at a very high risk of fractures. So those that's fractured before, or the very bad osteoporosis, or the really elderly, those might need the anabolic therapy, which sort of builds new bone, and then followed by anti-resorptive treatment. So it can be a bit complicated. You know, there's certain side effects that patients are scared of. Like they say, it's a very low risk, but you get some atypical femur fractures or osteonecrosis of the jaw. But I've never seen any, but there is a risk of that. So nothing comes without, you know, risk. But that's why, you know, there's lots of bone specialists out there, or people that specialize in osteoporosis. So they're very valuable people to see if you're not so sure. So I think my going home message for the people out there, not just females, you know, obviously you want to go for your pap smear, you want to go for your mammogram, you want to have your prostate checked, but don't forget about that bone density, because that can definitely increase your longevity if you look after your bones.
Thank you, Dr. Vicky.
Pleasure, Jeremy.
Lovely to have you in the studio once again with us. Next week we're talking about, I know you
Eyes.
lined up something, eyes.
Yeah, about cataract and glaucoma.
Okay,
Those.
right. Good one. Look forward to that.